Hi, I'm RutiKarniHorowitz from Omanut Haleida, the Art of Giving Birth School for training doulas and childbirth instructors in a one-year integrated program in Tel Aviv. Please visit us at www.leida.co.il/school. This talk will discuss the topic of episiotomy and some of the methods that may be used in order to avoid episiotomy during childbirth. First of all, let's start by asking, what is an episiotomy? And why is it better to avoid episiotomy and to end up birth with an intact perineum? Well, an episiotomy is a surgical cut made by a midwife or an obstetrician during the second stage of labor. Until lately, it has been the most common surgical procedure in the world. This cut enlarges the opening of the vagina by 3 centimeters, which are a little bit more than 1 inch, and requires suturing as it damages the muscle tissues as a second-degree injury at least. The episiotomy involves a maternal trauma and requires a recovery period which may last a long time. It is alleged benefits for the mother, such as preventing 3 and 4 degree tears, better healing than from spontaneous tearing, as well as preventing incontinence and some other pelvic floor disorders, such as prolapses of the vaginal walls, bladder, and uterus, hasn't been proved. On the contrary, an independent Cochrane review that included 8 studies that checked over 5,500 women has indicated that episiotomy causes more complications such as more pain, greater blood loss, infection, deeper tears, and playing a role in long-term morbidity. The only cases in which episiotomy is necessary are if the baby is in a severe distress and needs to get out very quickly or needs to be delivered by forceps. In that case, episiotomy will allow more room for this maneuverability. However, this technique of cutting the perineum, which is the space between the vaginal opening and the anus, damages the vestibule and the pelvic floor muscle and is performed by scissors, usually during a contraction and under no anesthesia. Episiotomy was first mentioned in the 18th century, yet it took over 100 years to be commonly accepted after it was first published in a medical journal. Routine episiotomy was a common practice for decades. Its original aim was to enable the usage of forceps by adding about 1 inch, which is 2.5 centimeters, to the vagina opening. The direction of the episiotomy cut, at least in America, is from the opening of the vagina towards the direction of the rectum. Some obstetricians still feel more comfortable in cutting episiotomies since they may not have been trained in alternative or natural techniques for delivering babies. Fortunately, obstetricians are beginning to follow evidence-based practice guidelines, and as a result, routine episiotomy rates are decreasing. In order to minimize the chances you will get an episiotomy during childbirth, you may use the following techniques. Prior to birth, you may do the following. A. Start to perform perineal massage from your 34th week of pregnancy and use the Epino Birth Simulator trainer from the 37th week of pregnancy. B. Choose your care provider according to their episiotomy policy and statistics. C. Write a birth plan that relates to episiotomy in an accurate and most decisive way. Simply write, "I don't agree to be cut." In addition, make sure your health provider is well acquainted with the management and support of a slow second stage and with some perineum-friendly positions for the second stage. D. Maintain your vaginal and general health in a good condition. During birth, you may do the following in order to remain intact. A. Make sure your care provider is aware of your wish to avoid episiotomy. B. Make sure your care provider, who are involved in the birth as shifts may change, actually reads your birth plan. C. When your baby head is crowning at the opening of the vagina, use either a side position or on 6, known also as the cat position, in order to decrease pressure from your perineum as much as possible. Now let's discuss perineal massage. Perineal massage is performed from the 34th week of pregnancy. It is an excellent way to prepare to birth, both mentally and physically, as it increases the elasticity of the perineum and preparing it to the rather intensive stretching it will probably experience during the second stage of birth. While at the same time it helps you to focus on relaxation of the pelvic floor in reaction to pressure. The more you will exercise and adopt this new pattern of reaction, the better you will be able to relax your pelvic floor during the second stage of birth, which is important for a smooth birth.